Hi, my name is Sven Sparvek and I'm from Sweden, and I have been working as a physiotherapist in 25 years. I'm also a teacher in Kinesiotaping, and I have been watching a few videotapes on YouTube which are good and some are not so good. So I would like to introduce how we in Rehab Tape are taping our patients and the theory about why we do that way. And one of the YouTube films I have been looking at it on is epicondylitis lateralis. It's main called tennis elbow. And one of the films are showing one of the physio how he puts a pain cross on the elbow. We in a Rehab Tape use pain cross when we have a big pain and it won't go away, and we need to take the most of the pain away before we treat the patient. Then we put a pain cross on. What happens when you put a pain cross on is that you lift the skin, and everything which is under the skin, the fascia, the muscles, everything get more space. This space makes the vessels open and the blood circulation comes through, and that will make the pain to go down. That's very good if a patient have a lot of pain. The next thing we have seen on the film is that many of them are putting the tape from the elbow down to the wrist. This is good if you have a problem with the muscles. If you have overused muscles, it's good to use the taping in that way. Or if the fiber in the muscle is break, then you need the help to muscle to pull the muscle back. In a tennis elbow, we don't put it that way, because for us in Rehab Tape we are thinking a little bit different. If I have a muscle which is overused, I don't want to help the muscle to work more. I want the muscle to relax. I want to release it from the tension. And how can I do that? Yes, I can do that in another way. I can put the taping from the wrist up to the elbow, which means the tape is pulling down, and we know that it will relax the muscle when I do that. So it always depends on which way, where do I start, where do I end? What do I want to do with the tape? Do I want the tape to help the muscle to work up, or do I want the muscle to release, to let the tension off? That's important to know. But now it's very important for you to listen, because we want the tape to help the muscle, and we want to put the tape on to release the pain we have in the elbow. So what we have to do when we examine the patient is to see, does it give a pain when I press the muscle out, or does it give pain when I press it inside, or does it press more pain if I press it up, or does it more when down, or on the other direction? Because when we have a patient with a tennis elbow, they will say, oh, this gives release when you go that way, but it gives more pain if I go the opposite direction. Okay, that means we have to put a tape on the elbow which will give a release from the pain. So we call it correction techniques. I will show you later on how we in Rehab Tape in Sweden do when we treat a patient with a tennis elbow. Okay, let's try to put this on his tennis elbow. What we do is that we crack the tape and pull. When we do that, you can see the paper is coming off. And then we just put it on his wrist, a little bit on his hand. Put it like this, you see that? Now the arm is straight and the wrist is straight too. Now we keep our hand on the tape and we pull. And when we do that, the paper is coming off. This is a quite easy technique and it's very useful. Now you can pull a little bit out, then we put the wrist down, hold it down like that, and then we just roll it on. And this call is the name of the technique is muscle technique. You just roll it on and do one or twice like this to activate the glue. When we've done this, we bend the arm a little bit. We know that his pain was when we was pressing towards the inside, but when we press outside he didn't feel any pain. That means we need the tape to pull the muscles, the fascia, towards outside. So what we do, we take the next part, we crack it, pull, the paper goes off, we put it on like this, hold a little bit and just pull so you get the paper to come up. Take it out, so we leave 3-4 centimeters left. Hold the muscle, the fascia, pull it down and just drop it like this, and then just pull everything out. This is called correction techniques. Now we have a perfect taping for tennis elbow. Muscle techniques, which is about 25% of the stretch, and correction technique, which use about 75% of the techniques. This will give a good release of the pain for the patient. So now you have seen how we in rehab tape think and how we put the tape on a tennis elbow. I hope this will help you to understand the theory and that it will make it easy for you to put the tape on. If you want us to come to your country or to your town, be free to call us up and we will come and visit you, and we will show you how we use our techniques to help people to get release of their pain and their problems. You can always find us on rehabtape.se, www.rehabtape.se. Don't hesitate to call us or contact us, and we will come and visit you. Thank you.